Are you nervous about the vaccines? Should you be nervous about the coronavirus vaccines? That's the topic of today's Bold and Blunt, and I'm your host, Cheryl Chumley, giving you a Christian conservative look at today's news, politics, culture, and events. For 2+ years now, 3 years actually, we've been told, get the shot, get the shot, get the shot. It's the best way to protect yourself against the coronavirus and protect others. But is it really? And what about the safety aspects of these so-called vaccines, which actually aren't really vaccines because there was a redefining of the term vaccine by the medical bureaucrats. Most people think vaccine, that it protects you from getting a certain disease or virus. Well, guess what? Nowadays, the definition isn't that it protects you. It helps protect you. It helps. It maybe does its job from keeping you from dying or keeping you from a long stay at the hospital. Perhaps. I don't really know how you would rate that. I don't know how you would tell somebody, good thing you got this vaccine, otherwise you would have died. Because how do they know that? But this is the data that's being used to justify the continued nonstop push for vaccine, which, as I just said, is really shot, booster. And now we're finding out, hey, people are getting some heart issues. People are suffering things called ischemic strokes, those age 65 and older. But not to worry, they're still safe, they're still effective, they're still safe. Don't ask questions, get your shot, get your booster. Before I get into all that, I want to quickly let you know, if you like Bold and Blunt, you can get Bold and Blunt at edify.app. That is the online platform for your faith-based podcasts. And look, the more we hear about these so-called vaccines, which are really shots, the more we need some faith, right? It's looking more and more like the best safety mechanism against the coronavirus may be God, because these shots sure aren't doing what they were promised to do from the beginning. You can also get Bold and Blunt, of course, at WashingtonTimes.com. Just go there, find my name, my hyperlinked name, click on it, scroll to the bottom of whatever piece you happen to click on that I wrote, and find some easy-peasy directions on how to sign up for my 3 times a week newsletter. At the Washington Times contains all my commentaries that I write all day long about things like vaccine safety, which is really shots, things like contact tracing coming out of the coronavirus, things like the government's overreach with the coronavirus to justify continued seizures of individual liberties, things like that, going way back to even when Donald Trump was president. Much as I love Donald Trump, much as I hope Donald Trump wins again, under the coronavirus, wasn't a big fan of the shutdown of the country, wasn't a big fan of the war on the coronavirus and the push for vaccines and so forth. But at least he didn't mandate things. But at least what he did was out of love for America. Unlike this current president, Joe Biden, when it's all about control, money, power, so forth, so on. Anyhow, going back to directions, click on that. Sign up for my 3 times a week newsletter at WashingtonTimes.com. Comes right to your email box Monday, Wednesday, and Friday, and contains, as an added bonus, my twice weekly Tuesdays and Thursdays Bold and Blunt podcasts. I have some great guests. My most recent ones, Mike Pompeo, Kathy Lee Griffin, and of course, today's guest, who's going to talk all about what's going on with these so-called vaccines, which aren't vaccines, but are actually shots. I want to read you this from Johns Hopkins University of Medicine, right? The supposedly gold star of the medical community. Typical timeline of vaccine development in the United States. Right from their website, a typical vaccine development timeline takes 5 to 10 years, and sometimes longer, to assess whether the vaccine is safe and efficacious in clinical trials, complete the regulatory approval processes, and manufacture sufficient quantity of vaccine doses for widespread distribution. 5 to 10 years and sometimes longer. 5 to 10 years and sometimes longer. And yet, when these vaccines, which are really shots, were pushed through the regulatory process according to the medical community's own guidelines, pushed through, rushed through, we were told, shut up, don't ask questions. They're definitely 100% inarguably safe. And look, common sense will tell you, how do you know? How do you know? Well, because we tested it, and we're the government, and the government wouldn't lie. Agent Orange, the government wouldn't lie. Anthrax vaccine, the government wouldn't lie. And yet now we're finding out, guess what? There's some adverse health impacts from these shots, which are still being called vaccines. Ischemic stroke, what is it? Well, from the Mayo Clinic, an ischemic stroke occurs when the blood supply to part of the brain is interrupted or reduced, preventing brain tissue from getting oxygen and nutrients. Brain cells begin to die in minutes. A stroke is a medical emergency, and prompt treatment is crucial. Early action can reduce brain damage and other complications. So that's what's going on with some of these shots still being billed as vaccines. Go to CDC's website. Are the vaccines safe? Well, by gosh, yes they are. Yes, they are. Line number 1 under that question, what you need to know, are the vaccines safe? COVID-19 vaccines are, and then they bolded this part for added emphasis, safe and effective, and severe reactions after vaccination are rare. Well, isn't that nice? That's all you need to know. Bleat, bleat, go the sheep, get your shot, get your shot, get your booster, get your booster. It's for the good of America. You're not patriotic if you don't get your shot. You're endangering humanity. CDC recommends everyone ages 6 months and older get vaccinated. That means shot. As soon as possible to protect against COVID-19 and its potentially severe complications. Really, what are the potentially severe complications for those under the age of, say, 18? Like nil? Like nothing? Like 0.00 bazillion 0 point half a one nothing? And yet, those under the age, those ages 6 months and older, get the shot, get the shot, get the shot. The CD recommends it. Which shot? Well, all of them. Don't ask questions. Come on, bleat, bleat, go the sheep. Get your shots. And don't forget your face mask. And if one face mask is good, 2 face masks are better. So says Anthony Fauci, the guy who profits off the coronavirus. The guy who says he avoided entering the policy debate, but anytime a Republican went against his policy advisements to stay home, stay out of school, stay out of church, stop breathing around people, anytime a Republican tried to buck those orders, those recommendations, here comes Anthony Fauci wagging his finger, going on national media to scold and warn that people could die, people potentially could die. And this is the problem right here. Fear, right, combined with wishy-washy language driving fear. So you've got Americans fearful about the coronavirus because the data has been so skewed that nobody can get a good handle unless you really dig in deep, unless that's your full-time job, data analyst. Unless you dig in deep to get the truthful data, you've got American citizens still fearful of dying from the coronavirus. And then you've got these so-called scientists saying things like potentially, could, maybe, perhaps. And so just in case, we all need to put on our hazmat suits and walk around and stay 94 feet away from everybody. Wait a minute, the new guidance is 95 feet. Wait a minute, Anthony Fauci says if 95 feet is good, 195 feet is better. Stay home, stay away. Wear your face masks. Wear your helmets. You might fall and catch coronavirus and die. because coronaviruses are on the sidewalks too. And if you fall, you could breathe in that virus stuck to the sidewalk and die. And the only people who benefit from your death are the hospitals that collect money from the federal government because Joe Biden keeps extending the emergency health orders, the pandemic health emergency orders, even though the pandemic, according to his own words, has ended. We're still living in this state of emergency, which opens the floodgates for easy peasy funding for all these hospitals and medical clinics and medical executives and so forth. And it shields Big Pharma from things like myocarditis lawsuits or ischemic stroke lawsuits or people just flopping around on the ground the second they take a vaccine, which is really a shot. Don't ask questions. Get the boosters. Get the shot. Wear your 19 face masks. Put on your rubber gloves. And stay out of church. And do not sing in church. Remember when Governor Gavin Newsom actually went after the churches because people were singing? People were singing. And when they sing, they breathe out, and there might be some spit in their breath that could catch on the face of another standing less than the mandated 19 feet away, and that person could catch the virus. And even though most people who are healthy under the age of 65, the virus is just like a bad case of the flu, it doesn't matter. It may not be. It could get worse. People could die. And flood the hospitals and overfill the hospitals and stress the hospital's capacity, even though if you go back in time and actually look at the data, hospital beds, capacities and so forth, you see that every time around flu season, hospitals reach full capacity in some areas of the United States, particularly those areas where flu is an issue. But we don't want to look too deep into the data because that might show the full deceptions of the government to sell the fear, to continue the justification, to clamp down on individual liberties and keep the emergency crisis going over a pandemic that has long ago ended so as to free up the money flow from Big Pharma through the political world to the hospital and medical communities. But what do I know? What do I know? I'm not wearing a face mask, so apparently my brain's not working properly. Well, somebody whose brain is working properly is my guest today, and she is here on Bold and Blunt to talk about some of these vaccines, meaning shots, and the efficacy of these vaccines, meaning shots, and the safety of these vaccines, meaning shots, and hopefully can sift through some of the government narrative, get the shot, get the shot, get the shot, shut up and get the shot, and decide for yourself whether these shots are actually safe or not. Her name is Vandersteel. She is co-chair of the Zelenko Freedom Foundation, which bills itself as an organization committed to paving the way for a new future and inspiring a courageous generation committed to truth. And let me tell you, the way the coronavirus tyrants are brainwashing the younger generation into believing that the only thing that will save them are face masks. And if one face mask is good, two face masks is better. The younger generation needs a good dose of truth. So Ann Vandersteel, let's talk about the COVID shots and what's going on. And let me first welcome you to Bold and Blunt. Thank you for being here.
Cheryl, it's truly an honor, and I followed your work for a long time. It's really just remarkable to see how everybody is coming together when you have a common enemy that's now revealing itself in real time, sadly, as of the outcome of these COVID jabs that have, impacted billions of people around the world. The die suddenly is not a conspiracy theory anymore, Cheryl, so it's a pleasure to be able to bring this to your audience today.
I am so happy to have you on here because for the longest time, as I'm sure you have been doing as well, following the truthful data of these so-called vaccines, which have really morphed into just shots, chemicals injected into people's bodies. And to this day, if you question the efficacy and safety of these shots, you're still called a conspiracy theorist. So tell me what you found by tracking this very important issue.
Well, really, this goes back going on 2 years now, looking into when COVID first arrived on the scene. Dr. Vladimir Zelenko, who I am co-chair of the Zelenko Freedom Foundation, carrying forward his legacy, he shined this bright spotlight into the big pharmaceutical medical industrial complex, exposing the collaboration, the conspiracy to hide the truth for profit, using the seemingly nice-sounding public-private partnership, which is nothing more than fascism of corporatism and government working together for profit, with really zero safety net for the people. And frankly, the data that's come forward that, say, Pfizer tried to bury for 75 years is now showing that, I know, right? Imagine that. The people that are supposed to protect us are trying to bury the data to show how bad these things really are, because they're full of chemicals, which frankly are on the do not ingest if you're a human being list. But, again, you were not allowed to know that, and it's just through the work of a lot of great open-source journalists and putting research together that gets you a tinfoil hat conspiracy theorist branded label and banned off social media, for which, whatever you think about Elon Musk, thank goodness for, bringing Twitter back into the realm of, hey, we have free speech. We're finding all this out, and now the general public is finding it all out, and those of us labeled are being sort of exonerated in real time. So the vaccines, so-called vaccines, let's be clear, Cheryl, they had to change the definition of a vaccine in order to establish that mRNA modifying technology that modifies your gene sequence, which is what God gave us. God designed a beautiful human being. They're now changing it because these people, in my humble opinion, are Satanists. They don't believe in God. They're anti-God, and they don't want his being, his likeness, walking the planet. So this is their plan, their agenda, and we were nothing more than lab rats in a giant human experiment.
There's so much to unpack from what you just said, and I'm so happy you said that, because I've been saying that myself for a very long time, and as you have. And let's just fast forward to today, right? With all we know, the left out there, the globalists, the Joe Bidens and so forth, are still pushing for shots in babies as young as 6 months. What is going on with this all-out push, this continued push, even though data is showing these shots are dangerous in many instances?
Well, we're living in an MK Ultra world where media has been weaponized. Barack Obama, with the Smith Modernization Act of 2012, allowing to turn mainstream media into a truly weaponized propaganda machine. The CIA has been using Hollywood for years. This is all coming out. I mean, this is not conspiracy anymore. This is fact. They are in an all-out race right now because the truth is erupting like a tsunami everywhere across the world, and people are realizing in real time what is actually happening. They are trying to still, lull us into a false sense of security by just, continuing to repeat a lie, because if you repeat a lie enough times, people will just take it as fact. Well, people are now waking up to the lies. And so, again, these people don't believe in God, Cheryl. They believe in worshiping something not God. And if you believe in Satan, which I think if you look at what these people are doing, you can see the agenda is clear. My goodness, the Georgia Guidestones that were erected, nobody knows where that came from, that came down this past summer right after Dr. Zelenko passed away. I'd like to say he had a hand in that, but I say that in jest. But, they put it and chiseled in, a dozen languages, saying we only expect, for a healthy world to have 500 million people on the planet to live in harmony with nature. We're pushing 8 billion, Cheryl. So Bill Gates has gone on record in his own TED Talks talking about using vaccines to regulate population and reduce population if we do a good job with vaccines. Those are his words. So at what point do people take off the blinders and I guess put on the tinfoil hats so they can take in the signal more clearly and listen to what's going on from these people's own words out there? I mean, look, climate change and a war on carbon and a war on nitrogen. My God, our air we breathe is majoritively nitrogen. I use nitrous oxide when I'm diving because you want to go deeper and you want to stay down and not have the bends when you come up. This is insanity what they're pushing right now. But again, logic flies in the face of the public when it comes to the mainstream media because you're listening to some jabberhead on a box on your wall. And they're parroting the narrative of the World Economic Forum, which has nothing to do with what God created with humanity, which is just allowing human beings to live freely And, that does not comport with what these demons want. They want full globalization, new world order, one world government, you do as we say, and, we get to go about our merry way, and the hell with the rest of the serfs. That's how they see us.
Do you take any sort of optimism from the fact that even outlets like CNN are starting to report about the dangers of strokes from some of these so-called vaccines, these shots?
I absolutely do, because it's about time when, you start to see all of these young producers, and there's been many articles of another young producer, 24, 30 years old, dying suddenly from cardiac arrest. I mean, when in the history of mankind have we seen so many young people dying? So now it's coming home. This is coming home to roost, in the very population that carried the water for Big Pharma, the mainstream media. Fake news essentially is now witnessing their underlings, the people that produce the shows for these talking bobbleheads that purvey, lies that are, basically perpetrating crimes against humanity. They're seeing their own perish for these unexpected reasons, dying suddenly of cardiac. So I think that's a wake-up call. We know that the NFL experienced a tragedy a few weeks ago. Fortunately, Mr. Hamlin has survived. That is incredible. But the look of horror on their face of these NFL players going, my God, I was forced to take this so I could continue playing football on the field, something in my whole life I've done I love. So this is the wake-up call, sadly. It's sort of like, Mom, is that stove hot? Yes, little Johnny, don't touch it, but little Johnny doesn't believe Mom, so he touches the stove. Well, humanity has now touched the stove with these shots, despite all the fact that you, myself, and many others were out there, screaming from the rooftops, don't do this. They've done it anyway, and now those chickens are coming home to roost. And this is why the Zelenko Freedom Foundation, Cheryl, exists, because we are, looking for solutions and already starting to get behind solutions for people to help detox and, hopefully, prevent the next usurpation of body sovereignty, but also, more importantly, save the ones who sadly believed what was being spewed on the mainstream media. So, we're at a unique period in time, Cheryl, very unique.
Talk to me about the numbers, the statistics, the data of what you've discovered, because I know it's difficult to get the truthful data about adverse health impacts from these shots. So put in context for me the data about adverse health impacts from these shots compared to past vaccines or past shots, if you can.
Oh, certainly. Well, let's just take the swine flu vaccine. We all can talk to that pretty sanely. The swine flu had a vaccine put forth, years ago that had an adverse event profile where 59 people died across. I think it was, forgive me if I forget the right number of states. I think it was either 6 or 9 states. 59 people passed away, so they took the vaccine off the shelf. They stopped administering it. We are now into the, if you believe theirs, into the tens of thousands. But frankly, we all know that the vaccine adverse event reporting system, theirs from the CDC, is wholly inaccurate because of the complexity and the time it takes to fill out of theirs adverse event report. From a physician's perspective, it's at least a half an hour per patient. So if you take the fact that they themselves are saying, well, we only are getting about 1% of the physicians reporting, and you look at the VAERS database, you're talking about millions of people who've had adverse events, and that's just in the CDC's database. Now you extrapolate that to, you look over at what the National Health Service is over in the UK, again, millions more impacted. This is not insignificant in terms of adverse event profiles, what we're looking at. Pfizer's own data showed extreme adverse events, and they tried to bury it. My goodness, Cheryl, the reason we never had mRNA injections before was because every animal that they clinically trialed died in the clinical trials, yet they didn't do any animal testing for this. Warp Speed pushed it to market, and the human population is now the lab rats in the clinical trial. Bibi Netanyahu and Alex Burla from Pfizer, Bibi Netanyahu, Prime Minister of Israel, and Alex Burla of Pfizer, we're talking about how proud they are that the Israelis are 98% vaccinated, and that they're now tracking all the different comorbidities and adverse events, and they're excited about this. I'm thinking to myself, my God, did you not learn anything from the Holocaust? Why are we repeating this? And I mean, we know history repeats itself, but at such a scale, this is beyond the pale of crimes against humanity. It's next level, just demonism, if you ask, if I'm to speak humbly here. That's what I see this as. It's just extraordinary that we're having to actually witness this and now try to come back from the brink.
It does seem very demonic forces pushing for the nonstop compliance with the government narrative regarding COVID mitigation, which any data now shows aren't justified, aren't based on science and so forth. And so I agree with you that it does seem to be on a different level what's taking place with these COVID vaccines, COVID shots, COVID boosters, and so forth. I wonder if you can draw a parallel or draw a link between the forced face masking and how that leads us down a path to continued COVID mitigation according to government narratives.
Sure. So, again, forced face masking has so many different connotations, right? It's been proven over and over again. Even Fauci acknowledged face masks don't do anything. That was his first response when asked by a reporter. That clip has been played ad nauseum. But the forced face masking also it's all about silencing everybody and putting you into compliance, making sure that you're not speaking out. The Denver International Airport has had artwork up for a long time, and it has a bunch of children wearing face masks, and each mask represents their flag of the country from where they're from. This came out long before COVID, at least a good 10 or 11 years before COVID supposedly was a novel virus, which we now know is anything but novel. It was manufactured and created in a lab. But the forced face masking is, again, another constraint that the New World Order wants to use to put people, submit them to the fear porn, that if you don't mask up, you're going to die from the next whatever pandemic that they have coming down the pike. And again, this is stripping people from their belief system that God gave you a perfect immune system, and it's designed to go to battle when it encounters viruses. Cheryl, we are surrounded by 2 trillion viruses every second of the day.
Right.
It's just what we live in.
Right.
Del Bigtree did a wonderful podcast about this, using a big bag of grains of rice, spilling it out across this table there in the studio and picking up 17 grains of rice, coloring one of them red and saying, "This is COVID." They threw it back in the pile. And he's like, "Why did we choose these 17 for vaccines? Why is that? Why?" And when you look at, the fact that, certain people have propensity to be, allergic to whatever, or they're susceptible to whatever disease. Why aren't we treating that person? Why are we inoculating millions and billions to save one? It doesn't make sense. It's not that one life is more valuable or less. It's just, let's think about this logically. How do you solve a problem? They're trying to fit square pegs in a round hole, but it's more really about changing who you are. Klaus Schwab said the Fourth Industrial Revolution was about changing you. And again, it goes back to these shots. And I got to tell you, this is an interesting story, Cheryl. There's an attorney, Todd Callender. He's with Truthful Foundation, phenomenal guy. I flew out to Denver to watch him level an argument against up in front of a 3-bench panel of judges in the 10th Circuit Court, where he was arguing on behalf of military that were suing about, being forced to take the vaccine. And he asked the judges, at what point do we not question whether or not the patent holders of these vaccines are now the owners of the vaccine recipients because they've changed your DNA? Ergo, you aren't you. You are now beholden and property of the people who created the vaccine. So, and again, we know, BlackRock owns it all. So are you really ultimately property of BlackRock? What have you become? So we have to really look at this whole problem in not just silos, a little, it's a mask thing, it's a jab thing, it's a 1A thing, a freedom of speech thing, it's a body sovereignty thing. It's really what is the big agenda here? And it's frightening that the Hollywood people have been telling us for a long time what they intend to do, and I liken what they're trying to do with us. But if you've ever watched Star Trek and the Borg, where you have the hive mind and everybody's linked, that's essentially what it looks like they're trying to do to us. And that's as crazy as it sounds, but look at how crazy these people are. I mean, they are, like I said, having a war on carbon, trying to suck carbon out of the atmosphere, and they're trying to, put a ban on nitrogen so you can't grow crops and feed the world. This is how insane they are. So I don't put it past them that the Hollywood projection is, in fact, the design of which they want to go.
So I want to finish with this last question because you lay out precisely how things are linked together. And the problem here is many in America, many around the world, may be seeing problems with the whole COVID mitigation that the government has put forth, but maybe they're not drawing the links. And I don't think people are drawing the bigger picture links. Maybe people are against face masks, but they understand and will wear them anyhow because they want to make other people feel good. Or maybe they're against vaccines, but they're not seeing how it all connects with this globalist agenda that you just laid out. So, taken all that, put all that into consideration and answer this. How do we effectively fight against what's taking place with the globalist vision, using the fears of the coronavirus, fears ultimately of climate change to control the world's population? How do we fight effectively?
Two fronts. One, if you're a Christian, I say pick up your Bible and read a chapter a day or read for 10 minutes a day and just, get closer to God. It's important that you lean on God during these trying times because He will always show you the way and light a path. However, God gave you a brain, He gave you free will, and He gave you discernment. So you need to start discerning. And I think for Americans, because freedom is in our DNA, we are a country that we were founded on freedom fighters. I think when you look at where we are as a country today and where we initially started, what we set out to do, we're 180 degrees from where we started. That being said, we the people are the government. So when we appreciate that we govern ourselves, right? Local action, as General Flynn says, local action has national impact. So when you talk about self-governance, it starts at home, right? With your family, parents, children. It goes into your community and then into your county and then your state, et cetera. We need to take back our government from these people. We cannot allow them to just railroad us based on their own treaties that they're, surrendering the sovereignty of the United States to the World Health Organization. We can't live with that. Our founding fathers didn't die and come over here and sacrifice everything, including their treasure, sacred honor, to have us give it away back to the very same people that they ran from. We have to take responsibility for that, Cheryl, and we need to start standing up. I'm going to throw this out to your audience. Carrie Lake, we all know she hands down won Arizona. She could very easily, go ahead and stand up as the de jure governor, saying, you know what, Katie Hobbs, you're de facto government. You're a statutory organization over there with administrative law. You don't stand on the Constitution, but I do, and the people stand with me over here. So we're going to stand on the Constitution of Arizona and of the United States, and we're going to deploy articles in our Constitution of the state of Arizona that say when the government's not listening to the people, we reserve the right to alter and abolish. Every state constitution has a paragraph in there that says just that. So Carrie Lake could assume the role of de jure governor in Arizona, and I assure you that there would be people like Mark Fincham and Sonny Borelli and Wendy Rogers and others that would come and stand up a government of the people again, and just let that other demonic parallel universe over there just fizzle out, because nobody wants to be a party to that anymore. We're tired of funding it. We're tired of surrendering our rights to it. So why not let a Carrie Lake be that person that stands up? She's of the people. Be the people's governor. And I think that's where we need to go. Our governors need to get a backbone. Our sheriffs need to get a backbone. And the people need to show the support there. And when you can't get it, when you cannot find those people, then we need to stand ourselves up on our own again. It's right there in the state constitutions. Read it and weep is what I say.
And you bring forth a powerful message, and I hope people listen to this podcast at least twice just to go back and gather all the info that you gave. But I assume there's plenty on your website, Zelenko Freedom Foundation, the organization that you co-chair, yes?
Yeah, we've got some incredible stuff going on. And folks, for those that want to actually get calls to action, but with an action plan, strategy when you leave, we actually do have an amazing event coming up at the Trump Doral in Miami on March 11th. We have 4 amazing panels, and one of my favorite panels, of course, is the American dissident, which I fancy myself to be, someone who is fighting for freedom, and we're going to give people takeaways, things that they can do, action items, so they don't just get talked at, but they're engaged with, so that then when they leave that panel, they're actually learning something and they can take and go and do something. This is the whole point here. We want it to be a solution summit, And after our panels have concluded, we have a break and then a beautiful gala dinner where we are honoring Steve Bannon as a freedom-fighting patriot in media. We're honoring Catherine Austin Fitts for her worldview on globalism, and we're also honoring Judy Mikovits, who is going to be receiving the coveted Zelenko Freedom Award. And we can all appreciate the work Judy has done in exposing Anthony Fauci. And Charlie Kirk will be our keynote that night, so it's going to be an extraordinary evening. I hope we see you there, Cheryl. It'll be fantastic.
Well, what you just laid out is I was just thinking that, maybe I should come. So maybe we'll meet in person in March. In the meanwhile, Ann Vandersteel.
I would love that.
You do some amazing work. I hope people go to your website, Zelenko Freedom Foundation, check it out, and get involved, because discernment is great, but it needs to be backed by action. So thank you so much for being on Bold and Blunt, Ann, and I hope to see you in March.
Thank you, Cheryl.
You know, if you want to sum up the takeaway here, it's this: God-given rights. That is the war, at least in America. You fight for God-given rights and everything else falls into place. If you put God at the helm of society, all that ails society just goes to the wayside. That right there is the war. If you like Bold and Blunt, I want to remind you, you can get Bold and Blunt at edify.app, at washingtontimes.com, or guess what? Wherever fine podcasts are offered. Yes, just go to Google, type in Bold and Blunt podcast, and see all the places you can get it. Sign up, subscribe, listen in, and get involved in the fight for individual God-given freedoms in America. I want to thank you for listening. Tune in next time. And in the meanwhile, don't forget, stay blunt, stay bold.